All right, everyone. Thank you for your patience as we were getting set up and letting some people get in. It looks like we've got a pretty good amount of people on, and we'll probably have a few more joining us as we go along here. I wanted to start off by thanking you for joining us during what is undoubtedly the busiest season in the health market, and take some time to give you a couple of housekeeping notes as well. We're going to be presenting today two of our most powerful tools that we have to offer to you. We're going to be talking, I will be talking specifically about our senior quote tool. That works with all of our senior market products. We have our MedSups, MedAdvantage, PDPs, hospital indemnity, senior dental plans, and even our final expense is quotable through this tool. I'll be focusing today on the Medicare side of that, the Medicare supplements and the Medicare Advantage specifically. Micah Matthews will be then joining us to present our ACA Cloud software and demoing some of the capabilities that it has for you as well. We're likely to have a number of questions as we go forward. You will notice on your screen you have a little hand icon there that if you press that, it'll allow you to enter a question, and we will be able to gather those questions, and then at the end of each segment, we'll take a few minutes to answer the questions that you sent through. It's likely that we won't be able to answer every question today just due to time constraints, so if we don't get to your question, please feel free to contact us here at the office. You can ask for myself or for Micah Matthews, or really anybody on the marketing team should be able to help you with get an answer to your question. So without further ado, I want to go ahead and get started. I'm going to be talking about our senior market quote tool. I've just went ahead and started with our homepage. This is messerfinancial.com. Hopefully everybody on the webinar is familiar with it. If you're not, this is where you're going to want to come to get all of your information about what we're doing, about our products, about all the resources that we have to offer. You can go ahead and start here. This is the navigation bar. We're going to go to the Agent Resources tab, and you're going to get a drop down of different selections. We're going to go to Quote Tools. This is our Quote Tools page, and as you can see, we have a number of tools available to you. I'm going to go ahead and select the Medicare Supplement, Medicare Advantage, PDP, Hospital Indemnity Dental Quote Tool. Now this will open a new tab for you, and if you've never used this system or you're not registered to use this tool yet, you'll want to select to request an account, and you'll fill out this page here with your information, with your email, generate a password for yourself, and submit that. And usually we get those activated within the day, so it shouldn't take long to get you set up. We'll go back to the login page and go ahead and sign in. And here we go. So this is your dashboard view. This is the standard view when you log in. You're going to be able to see here right in front of you a number of different options for you: hospital indemnity, dental, Medicare Advantage, Medicare Supplement, and final expense. I'm going to go ahead and start by showing you the Medicare Supplement quote. So we'll run a quote. And what we're going to do first, it's going to ask you for a zip code. And I'm going to go ahead and load in one here. And I know there's people from all over the country, so forgive me if I'm not selecting one near you. The functionality is the same regardless of what state or county that you're running the quotes from. One thing I forgot to mention earlier is that we won't actually be getting into the details of any products, just again due to time constraints. I would like to take some time maybe at future events to go through some of the Medicare supplement products and get into the details there. But again, we're trying to get as much information about the tools themselves into this webinar with the hour that we have allotted. So we're going to start with Mecklenburg County. We've got a 65-year-old. We've got a female pulled up. Right now, we can quote an F plan. We can quote any plan from here. I'm actually going to select a G plan as this is becoming the more popular plan. And of course, the F plan is scheduled to not be sold starting in 2020. So we are heading in that direction. But you'll find typically that the G plan is a very popular plan right now. So after selecting that, we'll have it initially sorted by price. It has today is the effective date. Obviously, if you're familiar with Medicare supplements, the actual effective date, the earliest you would be able to get would be for November 1st. But this just shows that as the default. We'll run the quote. And now what you see here is a list, basically from lowest to highest in price, of all the MedSup offerings that we have here in North Carolina in Mecklenburg County. It begins with Thrivent Financial. You see at $92.15, and I'm going to scroll down through here so you can see all the different options. There are clearly many MedSups that you have to choose from. At the bottom here, we have the American Retirement Life, the former Cigna product at $233 is the high end. So there's obviously a broad difference as you're looking at it. What you're going to notice, though, is that towards the lower end, there's not a tremendous amount of difference that you see between premiums here. So you may be wondering, well, how do I decide what would be the best way to make a recommendation to my client? Some people may be thinking right now, well, what pays the highest commission? And that's fair. That's a fair thing to say because honestly, a lot of these Medicare supplements are basically commodities. You know, a G plan with any company is a G plan with any other company. The benefits are identical. So really premium has the most to do with what selection you're going to be made. But there are some other things that you're going to want to take into consideration. For example, you'll notice inside of this box here, you see a lot of information. You see a shared household discount of 7%. You also see that there's a $25 policy fee with Thrivent. So those are two things that you want to take into consideration. You get some more information here. The parent group, Thrivent Financial Group, you can see their AM Best rating. They are an A++ company, which is outstanding. You see the rate type is attained age. Which plan you've chosen. They show the S&P rating, which is not available for this particular product. And you can also see that Thrivent has had a product available in the market for 36 years. Now, that's not necessarily 36 years in North Carolina or the specific state that you're in, but that's how long they've been selling Medicare supplement policies under this particular name, Thrivent Financial. So you can see that all this information is available for all the carriers when possible. Now, over on the left, you can see that there's a button here that says Adjust View, and then there's a few different options that you have underneath here. And these are what really bring a lot of power to this tool. The first one here, you can select to apply discounts. So anybody that's got a household discount, you'll see the price drop. And this is what that price would be if you had two people in the house that are purchasing the product from you. You can also set it to look at an annual rate. A lot of carriers will discount the rate if you purchase on an annual basis. So you can look at it that way. Which one would be a better fit that way? Here you have market analytics, and this one is really kind of special. This particular tool has put a lot of time into researching data, and this presents that data to you really in a way that you can use to help people make comparisons. You can see here the first column shows age increases. So you can see that from 66 to 67, really 65 to 66 to 67, there is no increase. So the rate is the same for all three of these age bands. You see your first rate increase due to age at 68, and that's a 4.4%. And again, it's 4.4% at age 69. And then they show you what your average increase year over year is here at 2.2%. They also show you the rate increase history. So in this column, you're seeing that in 2013, they had a 5.5% rate increase. They had a 6% increase in 2014. And then you'll notice here they actually had a rate decrease of 7.4%. And the average is a 6.3% decrease. Nationally, they have 28,000 policies, so this gives you some idea of the scope and the size of the company that we're working with here. And this is how many they have in the state, 460. Now that number is small because Thrivent is actually a relatively new product in North Carolina. And you can see what the national collective premium is for this product, $69 million, and you have $1 million in the state. Their loss ratios are at a 67.10%. Now this is actually a fairly important number to look at because it can, to some extent, predict what future rate increases you'll see. All right, you can see also down here there's some differences as you start looking at Aetna and Shenandoah. Now you may have somebody who's very analytical who says, well, how do the top three compare? So you can simply click anywhere in this red bar here and select that company for a comparison. So we'll take the top three, Thrivent, Aetna, and Shenandoah Life. And then we're going to come to the left-hand side of the screen to where it says Compare Quotes. And you can see that it highlights green when I put my mouse over it. So we'll click that. And now you have a side-by-side comparison that you can use either while you're sitting with a client or alternatively, and I think this is a pretty fantastic option here as well, it will turn it into a PDF for you. Now you have a PDF that you can download to your computer and take with you. If you have people who are just even remotely tech savvy, you can attach this to an email and send it to them for their review. But it's really, really great. You can put this into your bag and have it with you. You can print it off. So very, very nice. It's clean. You get a really good idea side by side of what you're looking at. And I think it's really fantastic. Now we're going to come back and we're going to go back to our main quote screen. And I wanted to get back to one more feature over here on the left that I think is really, really unique. You see this tab here, it says underwriting. And you can actually add underwriting criteria to your quote. So let's say that you know one of the most common things I think all of us are familiar with if you've written Medicare supplements in the past is the effect that diabetes has on the ability for people to get insurance, especially as a senior. So if you have somebody who is diabetic and dependent on insulin, which one of these policies or any of these policies can they get? So you click this box here. It says diabetes dependent on insulin. All right, and you notice it immediately adds an additional category over here to the right. What you'll see if you look at Thrivent, you have your category, diabetes, the criteria, dependent on insulin, and the look-back period. So if they've been dependent on insulin in the last 5 years with Thrivent, that's on the application. They're not going to qualify for this particular plan. So you can tell right from this dashboard and right from this tool whether or not this is a policy that will work for them based on some general health questions that you can ask. If you look down here, you can see Aetna Health and Life. If they're currently dependent on insulin, again, that's not something that they're going to be able to get. If more than 50 units daily, that'll be a knockout. So this is really probably Shenandoah so far is the most liberal that you'll see as far as insulin is concerned. As long as they're under 50 units, you will be able to get a policy for somebody there. So that can help you narrow down that selection quite a bit. All right. Now, the next, and probably, again, another very powerful feature that you have here, you may have noticed that there's some options here at the very bottom of each section. You can look at plan details, which will, again, bring up exactly how Part A pays, Part B pays, and how the Medicare supplement will function with that. What you pay is here. It gives you a side-by-side display, and you can actually do a printable version by clicking here. You see it's grayed out on this option, but there is an electronic application option. There's also a PDF application. So with Thrivent, we can select a PDF application, and it will bring up exactly the application that you need. And you can see that this is a North Carolina app. If you were in South Carolina, they would bring up the South Carolina app. If you were in Texas, they would bring up the Texas app. It does all this automatically for you. And from here, you could print the application off and take it with you when you go to see your client if you were doing some of this over the phone or if it's a second appointment. And we're going to go back. And we're going to go down to Aetna Health and Life Insurance Company. They have an electronic application option. So when you click here, it will actually take you to Aetna's login page. You'll put in your username and your password, and from there you'll be able to fill out an electronic Medicare supplement application on their website, and it's under your login, so it'll be tied to you, and it's extremely convenient. And I know one of the questions we're likely going to get here is this something that you can do over the phone? It tends to be on a carrier-by-carrier basis, but if they have an electronic application that allows for e-signatures, that is something that you could do right over the phone. And one of the things that you're going to notice is that more and more of these carriers, Shenandoah has it, IAC has it, Cigna Health and Life, this is Cigna's new product. They have an electronic application available. So it's really, really becoming a very popular option to have available to you. So that's really some of the detail of really the high points of this quote tool and some of the really powerful things it can do for you for Medicare supplements. I do want to show you how it functions for Medicare Advantage. It's not going to be quite as much capability, mostly because the government has strict regulations on how you submit applications with Medicare Advantage plans. But I want to show you how that works as well. So again, we're going to pick the 28227, pick Mecklenburg County, Medicare Advantage, the effective year 2017, and we'll say Get Quote. And here you have all of the standard Medicare Advantage prescription drug plans that are available in Mecklenburg County. You can see you have your United Healthcare, your Humana, Aetna, and so on, and it's arranged by price. You start to see here with this Humana HMO product, you have a $26.90 premium, and it goes all the way down to the bottom with the Blue Cross. Now, just like with the Medicare supplements, you can select multiple carriers and do a compare quote. And here you have a side-by-side comparison that you can present to your client. Okay. Also, just like the Medicare supplement, you can put it into a PDF format. And now it's emailable. It's also printable and something that you can have on hand. And of course, it has your phone number, it has your information at the top. I failed to mention that earlier, so they know who you are and remember who you are when you send the quote. All right, I'm going to go back. And again, you don't have the option from here, and maybe someday they'll loosen up on some of the regulation and allow us to do electronic enrollments, but at this point it's not something that you can really run or print from here. Likewise, the applications are not available through here. They're something that you're going to have on hand yourself. We can also take a look here and filter it by Part D. So if you want to know what Part D plans are available, you can pull it up, get quote, and you can see from lowest to highest what you have. The $17 Humana plan here, and there are many, many prescription drug plans. It goes all the way up to $124 per month with Blue Cross and Blue Shield. So there's a wide variety. One of the biggest discerning factors most people know is, does the plan have a deductible? It shows you some of that information here. It'll show you, you see a $400 deductible for most of these top plans. SilverScript is the first one you get to with no deductible, and obviously that's a very popular standalone plan right now. And finally, you can take a look at what special needs plans are available. So if somebody has special needs or dual eligibility, you can see that we have the United Healthcare has a couple of options, and we have a Humana here. So again, this shows the dual eligibility here. This shows that this is actually an institutional plan, as is this, and this is a dual eligible plan. All right. Now, I mentioned earlier we're going to try and keep it here to the to Medicare supplements and Medicare Advantage. I did want to show you that there is an ability here to, where is that? Let's see. Oops, that's not what I wanted to do, pardon me. Okay, from this screen, you can see there's an option here that says fill the gaps. So you can select that option and run with your Medicare Advantage plan a hospital indemnity plan. So we'll say it's the same female and our 28227 zip code. Run the quote. And then it gives you options to choose from. There are many, many options to choose from. So you would actually have to have some idea of what direction you were wanting to go. Maybe you have Continental Life, or maybe you have GTL, maybe you have Sentinel Security, or you have a pretty good idea of what benefits you want to offer, and you can add that to the comparison. And you see here, it'll show you benefit amounts for hospital indemnity, for skilled nursing if you want to add the benefit, outpatient surgical, all the different variables that are part of these hospital indemnity plans, you can adjust right here from the quote tool. So if you wanted to make this $200 a day, you could do that, and it'll show you that it's going to be a $21.77 premium. Or if you wanted to make it, let's say, $350 a day, which is a little closer to what the average daily hospital fee is for Medicare Advantage right now, you see that it jumps up to $35.75. So you could show somebody that was, and obviously you wouldn't normally be adding this on with the dual eligible plan or an institutional plan, but you could say, you know, if you're paying $0 for this Medicare Advantage, why not take $35 and cover some of your biggest exposures at the hospital or the skilled nursing facility, and spend a little, you know, spend the $45 to do that? And doesn't that make sense? So, and from here you can actually do, again, the PDF, and you can see it's now added that to your quote that you can print or email. All right, we're about halfway through our allotted time. So what I'm going to do at this point is open up, take a look at some of the questions that we have so far about the MedSup or the Senior Market Quote Tool. I'm going to have Micah Matthews go ahead and read those off, and we'll try and answer as many as we can, but we do want to try and get into the ACA software very shortly here. Micah?
Yeah, Jay, looks like Eric Bedelford wants to know, it appears that some med sub companies are missing. Why would that be?
Oh, okay, that's a great question, Eric. Thank you for asking that. Basically, our tool is set up right now to quote the tools that Messer Financial has to offer. We do not quote tools, or we do not quote Medicare supplement policies that we do not have a contract with. It's not capable of doing that on this tool. So, unfortunately, it's not something that we have at the moment.
Steve Holzer writes, I write a lot of Mutual of Omaha. Where is it on your quote tool?
Okay, I can quickly pull that up for you, Steve. We'll just go for the most basic, look at the Plan F. So, Mutual of Omaha. Here's Mutual of Omaha. All right, and you can see really what's happened is Mutual has just had a lot of rate increases recently, and so particularly for Plan F, they're down here at $145.71. And I apologize for not having those up. And again, I know I'm scrolling fast here. There are a large number of Medicare supplement policies that we do offer. And unfortunately, just again, due to time constraints, I'm not able to get into the details of every single one of those. But to answer your question about Mutual of Omaha, the likelihood is it was further down the rates than the top 5, and that's why you didn't see as I was scrolling through it. Good question.
There's another question here. Just log in and no supplements shown available for Cherokee County. Probably have to address that on an individual basis, I think, and we can go into it and look to see why that would be, because every carrier should show up that we're at least appointed with in that area.
Yes, what I'll do, we'll get back to you. That question, we'll give you a call after it's over and try and figure out what's going on there.
Another question is, what is the future of death plans?
That's a great question. They are going to be sunsetting that policy in 2020. So going forward after 2020 on, Plan F will not be available to be sold from any carrier. Typically what happens is those plans, the people who have those plans, Plan F, are able to keep them. But as with any insurance product, when you close the risk pool off from new healthy people, younger healthy people from buying those policies, inevitably the premiums for those policies will go up, and they'll start to go up pretty considerably and pretty quickly. Which is, again, why I mentioned earlier, a lot of people are starting to shift towards looking at plans like the G plan. I've seen people quote C and D plans even when those are available. And a lot of carriers are looking to possibly roll out D plans as well going forward in the future.
Another question is, I do some Medicare business with Messer and also other IMOs. Is the tool available to me?
The tool is available to you. The tool is available to you. You can actually just, again, go and register for it through the link. Let me go ahead and show that here. Again, if you just select here, well, I'll have to log out first, it looks like. Whoops, pardon me. Where's my sign out? There we go, sign out. And request account. It's as simple as that. You request the account and we'll get you set up.
Will this webinar be recorded?
Yeah, all of our webinars are recorded. It'll be available later.
The cost for the quoting tool during the OEP and after?
There is no cost for this quoting tool. I don't know if you might be referencing the ACA software, and that's something that Michael will be covering here shortly.
Another agent is asking, are you saying that we can show various companies' comparisons side by side? They were under the impression that it is a CMS violation to compare plans during presentation. Thought show only.
All of these comparisons that are shown on this quote tool are CMS compliant, so that is something that you can use. And I think at this point, what we're going to do, it looks like we're actually starting to get some ACA questions to filter in. If you do have more questions about the senior market tool, you can still ask. We will either answer them via this webinar, or if we run out of time, we'll try and give you a phone call personally or an email to address those for you. And I'll be sure the question that you had earlier about not pulling any supplements for Cherokee County, I will be reaching out to you after the webinar is over. At this point, I want to thank you for listening to me. Hopefully it wasn't too boring, and hopefully it was insightful, and you've learned a great deal about one of the more powerful tools that we have to offer. And now I'm going to introduce Micah Matthews to you. He's going to take over, and he's going to go ahead and give you a lot of detailed information about how our ACA software is going to function. Micah?
Yeah, thank you, Jay. One quick thing I wanted to point out, too, about that MedSup tool is one thing you want to be aware of. Check out the A&M ratings for these MedSup carriers. A lot of E&Os out there do not cover anything below an A rating, which means you'll be surprised at some of the ones that have no rating at all and below that. So if you are selling those products, there's a good chance that your E&O is not going to cover that, where Messer Financial actually, through our E&O, will cover all of those carriers. So that is something to keep in mind when you're selling this open enrollment period. Now, to the ACA side, obviously I know everybody is anxious to see how we're going to do it. There's a lot of changes, especially with the commissions and plans that are available. And hopefully after this webinar, you'll have a better understanding of exactly how to maximize your sales, and hopefully this bundling that we're going to be able to do with this software can make up any difference in the commission levels. So we'll go ahead and get started. The first thing you want to know is what are available on our cloud software. These are all of our ancillary products. So if you're not appointed yet, please make sure to do this now, because there is a backlog with these carriers to get appointed. Delta Dental, Carrington, VSP, and Renaissance Dental. These are all going to be under the Morgan & White platform. So if you want to get appointed with Morgan & White and have these products in your portfolio, I would recommend doing that as soon as possible so that they can get this appointment processed in a timely manner. IHC, they're going to also have their own gap plans, dental plans, and a telemed plan. So again, if you want to have those plans available, you want to get appointed as soon as possible, as there's about a 3 to 4 week backlog on their appointment process. So again, if you haven't done so, make sure to get appointed with IHC and Morgan White as soon as possible. So I'm going to go ahead and pull up the cloud software. Let's see. So the website for the cloud software, for those that do not know, is messer.insxcloud.com. And that'll bring you right to our cloud software. If you haven't already purchased your cloud software, you can do so at messerfinancial.com on our homepage. And if you're interested in learning more on how to get some discount pricing on that, contact one of us, either myself or Jay English as well, and we'll be able to discuss that with you. For my purpose, I'm actually going to be using a demo site. That way I can show you an actual enrollment. So that's what I want to do for you guys. It's actually a different website, so I'm going to have to just go to this website real quick for you. Okay, so log in, and it's the same on the other sites. It's going to be up in the top right corner. Once you click log in, and then you'll get your username and password. All right, we're just going to do it this way. Okay, so this is the home page where you're going to be. If you notice, there's a place in there where you can go right to the FFM to report a life change. You basically just choose the state, choose the effective date of the policy from 2016, and then you can go right to the FFM. And there's also a place that you can go if this is a brand new client, and we can start quoting it that way. To start off, I'll go ahead and take you to the FFM, show you how that works real quick to report a life change, because I'm sure a lot of you are going to have to do that this year. So we'll choose a state. We'll just say North Carolina because that's where we are. We'll do a 2016 policy, January 1st, and I'll go right to the FFM. Nope, supposed to go right to the FFM. Let's try that again. All right, that's not working out too well. Let's try it this way then. We'll do a new quote. So we'll just pick the zip code for here, 28227. Choose the county, Mecklenburg County. Choose the effective dates, 1/1/2017. Now, if you notice, there's a lot of things that are optional that you won't even need. So at this point, so you don't even have to put their last name. You won't have to put their email address or phone number or anything until actually they decide to do an enrollment. Also, basically, all you need is the gender, date of birth, and tobacco, yes or no. And I'll hit next. Now, here's where you're going to get all of your different plans. You can either select all of them, or if you don't want to, if you want to do a standalone supplemental, dental, vision, or medical plan, you can choose one or the other. For this purpose, I'll go ahead and select them all. And then if you want to see if your client qualifies for a subsidy, you can go right through here and then hit yes or no, and you can put in their information. So we'll go to the next page. So what we'll do is we'll put in their household income, since this is just an individual and I want to see if they do qualify for a subsidy. Let's say their household income is $25,000. For a single person, 47. Then we'll calculate it. It'll tell you exactly where on the poverty level that they fall, plus what they qualify for. And then once you have that information, you hit next. And the first page is always going to be the medical plan. So if you notice here, it will show you what the premium is without the subsidy. And then it will show you that there is a discount, what the subsidy amount is. And then with what's ever left over, that's going to be the total premium for the member. There's a lot of neat information that you can put on here. It shows you the deductible levels, the out-of-pocket maximum, what kind of co-insurance they are, primary care, if there's a co-pay, or if it's deductible co-insurance, all available right here. If you want in-depth knowledge of the plan in particular, there's a whole bunch of different information you can access here. If you want to take a look to see their formulary, plan details, you can see in much greater detail, summary of benefits, and even a plan brochure. So as you can see, there's going to be a lot more information on these. So that's how, and it will filter them from lowest to highest price plan, and it will show, even if you're not appointed with them, everybody that's in the market. Now, you can filter, if you want to filter your plans, you hit this narrow results by. So you've got metal tiers here, and you can pick any, if you just want to show bronze plans or silver plans, gold, whatever you want to do, you just check that and it'll filter it by that. And then you can do even plan types. POS, there is some that do HMOs and things like that, and if they're available, they'll show up on this as well, depending on your state and market. Now, I will tell you, the only plans that are going to be shown on this software are the on-exchange plans. So it will not quote any off-exchange plans, so there's really no need for this part on the medical plans because, like I said, they're all on exchange. So also, you can compare plans. You can do a side-by-side comparison if you want to do. There's a button right here that says Compare Plans. You click on that, and then a little box shows up by each plan name. So if I want to do the first 3 plans, let's say, you can do up to 4 at one time. You put a check by those, and then Display Plans. And then it gives you a whole breakdown of every benefits side by side, so you can really give your client and show them, you know, what's going to be in their best interest, out-of-pocket maximums, all of that needs to be put into consideration. So I'm going to go back, actually, and you can also put this in a PDF if you want to email it to your client or whatever the case may be, or you just want to print it out, you can put it in that PDF. So we'll click back. So once we're back into here and you've already chose the plan that you want to do, we'll pick Select Plan, and then Save and Next. So the second page is going to be our GAP plans. So IHC has two different kinds of GAP plans. They have what's called Metal GAP plans and CA Premier plans. Now the CA Premier plans, they're a little more rich in benefits, but again, still very good plans. And then you've got your Metal GAP. Again, we don't want to get into too much detail about the plans right now, just because we're more going over the software. But again, you can always get more details on them through the plan details and summaries. But I'll tell you, for those people that are coming off of a plan that obviously their premiums are going to be going up this year, and instead of and some people may want to go from a silver or a gold plan down to a bronze to try to save on premiums. And for those people, a GAP plan is really going to do well, because it's going to alleviate the concern of having a higher deductible. So if the biggest concern is, going down to a bronze plan is going to give me this really high deductible, well, now you've got a GAP plan that you can put in that place. And I'll tell you, the difference in between a bronze and a silver plan is a lot higher than going from a bronze and adding a GAP plan to it. So you're saving your client money, lowering their deductible, and GAP plans also pay well in commissions. So definitely something that I think anybody who's going to be doing ACA business this year needs to be able to understand these GAP plans and how to bundle them. So again, this is going to be priced from lowest to highest. And once you have your plan, you select a plan, save and next. And the next ones are going to be the dental plans. So a little bit about these dental plans. Carrington Dental, this is not actually insurance. This is a discount plan. It is a narrow network on these. However, there is no waiting period. So basically, if you have something major to do that you need to have done with your teeth, this is going to be a great plan to go by, because, like I said, there is no waiting period. So, and if you look here on the plan details and you pull up their brochure, you'll be able to see, for an example, the normal cost of a procedure, what having a Carrington plan, the negotiated rate is going to be, and then what the savings percentage is. Obviously, that's better than nothing, and it does give you immediate coverage. But the only downside would be it is a limited network. So that's one thing you'll have to make sure before you purchase this, to find out if there's any providers in that area. IHC is a full dental plan. It does have a waiting period. However, it is insurance. There is coverage, routine dental services. There is no waiting period. Just for major services is going to be the year, 12-month waiting period. So that's something. And also, it doesn't look like the CareMax plans are available yet on here. They're adding those. And those are also going to be full insurance dental plans. However, the difference between them and IHC is the CareMax plans do not have a waiting period as well. For major services, it will cover 20% of any kind of major services year one. So that's something to also keep in mind. But the IHC, what's nice about that plan is it's an indemnity plan and there is no network. So basically you can use this anywhere that there's a provider. So those are the dental plans in a nutshell. Again, you can always narrow these results. You can now I will tell you, if you're not appointed with these carriers, you will not be able to select the plan. It'll actually be grayed out, and it'll say if you want to become appointed with them, to go ahead and call this number or go to our website. But if you are appointed, then you can actually select them. So we'll go ahead and select this plan. Save it next. And now these are the vision plans. This is going to be through VSP. It's our only vision plan that's going to be available on our cloud software. And again, guys, these are just the products that are on our software. There are plenty of other dental and vision and GAP plans available from other carriers, but these are going to be the ones that are on our software and very easily quotable and easy to enroll them. And again, it's just the same thing, plan details. They have their brochures, which gives you in-depth information, and definitely something that you're going to want to read up on. So that's those, and then once you select that plan, then you have the telemedicine. Now, IHC Group is going to be on there, and that's a very good telemedicine. This is ideal for those that want to have some kind of consultation from the privacy of their own home. They do have screen face visual, so they're able to actually see you, which they can do, so they can actually prescribe things like if it was pink eye, for example, they're able to see it. They'll be able to prescribe you some kind of medications. It's very affordable and very convenient, like I said, because you can do it in the privacy of your own home. So instead of having to set up an appointment with a primary care physician that may take a while to even get into the office, you can do this pretty much immediately. So another thing to definitely keep in mind. When you select that plan, again, save and exit, and then it'll give you a breakdown of everything that was discussed. So you'll see here the first thing listed is the healthcare plan, which shows the subsidy and everything, so it shows you that amount. And it'll recap everything that we chose, the supplemental, the dental, the vision, the telemed. If you need to edit something, all you have to do is just click this edit button. And so once you've come to terms and they have decided that they want it, there's two ways that they can enroll. Number one is they can either start the application right there with you by hitting this green button, the start application. If you want to email this all over to the client so they can review it if they want to take more time, all you have to do is just click this invite applicants. It'll come up an email address already generated, and you'll put in their email address, your email address, and then it'll send it over to the client, and then they can review it. And if they like it, then they can actually apply through that email link. So again, it's just another way for them to enroll. But if you do want to start the application, you'll click Start App. And for some reason, healthcare.gov, that's okay, because it's been acting up, being that I know it is a shocker, healthcare.gov not working quite right, but it is right before the open enrollment period, and they are updating things. So unfortunately, the system appears to be down right now. But that's okay. So we can actually remove the medical plan. Let's see here. So if we go back to, let's see, the quote page should have our client still in there. Let's see. Yeah, so it has our quotes in there from people that we've done previously. But for this purpose, I'm just going to, since healthcare.gov is down, I'm going to go ahead and show you how to do a standalone dental plan, and we can walk you all the way through it. Now, just as an FYI as well, you're going to be able to make payments on our ancillary products. In fact, it will not actually go into force until you make a payment, and you can do that right through the software. However, to pay for a medical plan, you will have to either go through healthcare.gov, or you'll have to contact the carrier directly to make that payment. So I'll quickly run through a standalone supplemental plan so you can see how that works. Pick Mecklenburg County. So we'll just say, let's say that they just want to do a dental plan, and we don't need to do the subsidy. So they want to choose this Carrington plan. Save it next. Take them to the recap, and then you can start the application. So we start the app, and we'll just call our person John Doe. Email address, we'll say John Doe. And everything with a star beside it is something that you will need to include. So I do have actually a social here. Let's see. Okay, here we go. So let's just do our little made-up person here. Marital status, we'll say single guy. And address, we'll say 123. Carolina. Next. Now all you need to do, it'll ask you for their signature, electronic signature. All you have to do is just type their name in there. And as you can see, it shows you its signature beside it. And then once you're done, you submit an application. And then we continue. It's basically just making sure that you are aware of when the effective date is. This one actually, 11/1 is no longer available anymore. The first available effective date is 12/1, so it does let you know when the next available effective date would be. We hit continue. And then we can put in a credit card. So we'll say this is a Visa. Let's see. Say credit card, Visa. We'll just put in. We'll say. And then the zip code. And then it'll give you an agreement, terms of service. You'll want to say agree to them by checking those little boxes, and accept and pay. So it may take a couple of minutes, but as you can see, that probably took me less than 5 minutes, and obviously I was trying to go step by step, so a very, very fast process, and they will be enrolled and paid. So there's no further action needed once this goes through. And then once it does go through, you will receive a confirmation, and it should be emailed to them as well. So they'll have everything that they need emailed to them. And if they have any questions, obviously they can contact you guys. But this is an extremely easy process, and this really will help fill in the gaps from the lower commissions from the ACA this year. It's taking quite a while for some reason. It usually doesn't take this long. So I'm going to go ahead and actually just cancel this for time purposes. But like I said, it will give you a confirmation once it's completed. So let's go back, and I'm going to show some of these tools over here. So let me go back to our Messer Financial website so I can show you exactly how to get to these. So back on the Messer website, again, it's all in the quoting tools. If you haven't purchased the ACA Cloud yet, it's up here in the ACA portion, ACA enrollment portal. When you hit that, then it'll give you the general overview, and whenever you're ready to purchase it, just add to cart, and then it'll come up and it'll tell you what the price is, and that is monthly. You can cancel it whenever you want to, so if you want to only have it live during the open enrollment period, all you have to do is just send an email to our cloud department, which is acacloud at messerfinancial.com. Just let them know that you want to cancel that, and they will gladly do that for you. And then you just add it and then proceed to checkout, and that's where you'll put in your credit card information. One last thing I want to show everybody too. Let's go back to the quote tools. If you want a dummy and you want to play around with it before you purchase it, hit Health Quote. And now this actually will not have well, let's see if it does. I don't know if they've updated it yet or not. It will not have the ancillary, I don't believe, but you can still play around with it, see how easy it is to quote everybody. Again, all you need is just the male, date of birth, tobacco. Next. Oh, and it actually does. So yeah, they actually have updated everything, so you are good to go. You can see all the different products that are going to be available. And there you go. So you have them all available for you, and you can skip through it if you want to skip the medical. Just hit Go to Dental Plans, and you can just keep filtering through it that way. There's a lot of really useful information on this quoting tool. And if you do have any questions, like I said, myself and Jay English are always available. We're going to go ahead and look at some questions that have come up since the beginning of this. Let's take a look.
Looks like we got quite a few here, Michael. We'll try and get to as many of these as we can. Again, we're trying to stay within time constraints. We're obviously at 10 o'clock already, so we'll go a little over here. And if we don't get to your question, just want to apologize in advance for that. Let's see. Where did we leave off? All right. It looks like the first question we have here is will Ambetter be on the quoting tool this year? That's a good question.
Yes. So the quoting tool will have every carrier that's available, whether Messer Financial has the contract with them or not, for the medical plans. But all the ancillary is only going to show the ones that we do have contracts with. So that's a good question. And yes, Ambetter will be on there, and that way you can really compare all the plans. Now, like I said, you can always filter it to where you only show the ones that you're appointed with, if that's what you choose as well.
Next question, is the practice site available to all? And actually, as Micah just showed at the end there, we do have a functioning quote practice tool available on our website, and it will actually do the ancillary products as well.
And one other thing to show you guys as well, because you're going to get a lot of people that are, because the premiums are so high now, a lot of people are probably going to consider, dropping their coverage, and they're going to want to know what that penalty is. So here's a tool right here, the tax penalty estimator. So let's say that number of insured, let's say that there's 1 uninsured, 0 children, adjusted gross, let's say it's 25,000, or let's say it's actually 50,000. We'll make them a little higher. And there's his penalty. So they can see that as it went by, obviously the penalty keeps increasing, and then it even gives you what the requirements are on how that's calculated. So another really good tool for those that are considering not having coverage this year.
Does it show the simple choice option?
No, it does not. It does not do the simple choice option. However, there are going to be other tools available on the full website where you're going to be able to quote group, where you can actually compare a group quote. There's a census form on there, and a lot of other calculators too. So that should be also very helpful.
How do we, or can we, I guess is the question, pre-populate existing clients in the software if this was someone who had the software last year? Do we know what that functionality is yet, Micah?
Yes, actually, let me pull this back up again. The full site.
Do you want to go under this one?
Maybe. Let's see. Yeah, let's do that. So I'm going to go to the
Messer.inxcloud.com.
Log in. Okay, so let me go ahead and show you some of these things too. These are some things that I had left off. So, like I said, if you have quotes previously, you can pull up all the quotes that you had sent. Applications, once they become actually take an application, you'll be able to see these. And then if you have any enrollments, the ones that actually went through the process, that will all come up here too, and you can see all the details of it. Everything. So these work great. Also, applicant intake forms. This is very important because just like we saw, the healthcare.gov is currently down, so there's nothing I'm able to do, and you have a client available. So what do we do in this case? What you can do is you can send them this intake form, which you invite by email. You'll put in the person's email address, and it'll send them this link to your client. Your client then will go in and put in all of their information so that whenever healthcare.gov is back up and running, you don't have to contact them again because you already have all of their information. So what you'll do is once it's back up and running, you'll log back in with all of your client's information because they've already filled out one of these intake forms and be able to enroll them without having to have them present and waste your time and their time. So this is a lifesaver because I know that there's probably tons of you that have, anybody who's done this before has been up to the last minutes of the night trying to get one in before the cutoff because they had to wait. So this way you can do it on your own time. Another tool too is this plan designs. If you want to know what plans are in a certain area, this will literally come up anybody and you can filter it, choose what state they're in. So if I want to do a North Carolina medical plan for 2017, it shows up every plan that's available in North Carolina for 2017, and it has all their benefits here. And again, here's another life change event. Let's see if it's up and running yet. Ah, beautiful. So it actually did go through this time, which is a good thing. Let's see. Let me see if I can log in, if it'll let me do it here. It won't let me change it. So this is actually through one of our coworkers here, this website. So, but this is how it will take you there. Once you log in, you'll be able to update everything in the system. Now, last year it gave you an option of whether it's a new application or if you're wanting to look up an application. This year, they actually eliminated that to just one option. So when you go in, you're just going to go in as if they were an existing client, even if they're new. And when you put in their information and that person's not found, it'll automatically prompt you to do a new application. So that's just some changes. So for those that did it last year, that cut it off, if your information is not on there, there actually is a census form that we can send you so that you can upload all of your information back on the software. It's an Excel sheet, and all you have to do is just ask one of us, and we'll be able to get that to you, and then you can upload it right onto the software.
Okay. Let's see. Is VSP done through Morgan White?
Yes, VSP is done through Morgan White as well as Delta Dental. Now, unfortunately, Delta Dental is not available in North Carolina, so we're kind of limited. So like I said, the CareMax, the Caring 10 plan, and IHC are going to be the dental plans in North Carolina, but Delta Dental is available in other states.
Okay. I don't think we actually covered this at the beginning, but a good question is, do we have to pay for the use of this? And we've been sending out emails over the last couple of months detailing some of the ways that we can offer it to our agents that are exclusive Messer agents. If you want to talk about exclusivity and being able to operate on the software at no cost, please give us a call. Otherwise, as you saw when Micah navigated to the actual sign up for the software, I believe it's $65 per month. Is that correct?
That's right.
That's correct. Okay. Let's see. Is paying for medical? Let me see. This is worded a little funny. If you're paying for, can you pay for your medical and all your premiums at the same time? I think what they're asking is, can you pay for the health insurance and for the supplemental products at the same time?
So the answer to that is no. The medical, like I said, you cannot pay through the platform. You'll have to go through the carrier directly or healthcare.gov to make a payment for the medical. But as far as the ancillary, yes, you can. You can, and actually the plan won't be enrolled until you make that payment. So that's something that is important. Good question.
Okay. Outside of credit cards, do they take checking or savings accounts?
There is a ACH mode that you can do as well. There's either credit card or ACH, yes.
Great. Can you do an intake or invite for dental or supplemental products?
Absolutely, yes, you can do that.
Okay. Let's see, that's cost quoted cool. Let's see, review renewal process. Is that something that we've? If you have an existing client.
So if you have like I said, when you're doing a renewal, that basically would work as a report of life change. I'm highly recommending anybody who has clients from last year if nothing else, at least make sure that their subsidy is correct with CMS. Go back in through the portal and kind of like if you were going to do a life change event, at least just update their information. And if nothing needs to be changed, then at least you're confirming it, and that way you'll make sure that they get the true subsidy amount, because there were cases where someone had a subsidy last year, and because they didn't update their information, they ended up getting an incorrect subsidy amount. So that's one thing that you're going to want to make sure to go through each one of your clients.
Let's see. Can a client sign up from one of the invites?
Absolutely. So like I said, whenever you're doing a dental quote, at the very end, it's going to ask you, do you want to start the application or invite the client? Again, if you want to just send them the email and let them do it themselves, all you have to do is just say invite client, and you'll send them the link, and they can apply right through that link.
Can you port last year's Blue Cross Blue Shield North Carolina from last year to it? I think we covered that question. You're going to have to use a spreadsheet we'll send to you to do so. Is there a feature to share a screen, to do share screening?
I mean, the only way, well, No, well, there is a way to do a screen share, but it's not through our software. It would have to be something through like a
Citrix offers something like that.
GoToMeeting would be another one. Those are able to share a screen, but if they want to see what you're actually doing over the phone, the best way is just to send it to them in an email.
Is it too late to contract for ancillary products? Absolutely not.
It is not too late, but like I said, if you haven't done so already, get it in as soon as you possibly can, because like I said, there's a 3 to 4 week backlog on these appointments. So, if you do it today, you should have it in before, you should be approved before Thanksgiving.
Will we be able to embed a link to the quote tool on our website so clients can enroll on their own?
Yeah, so that's a good question. So there is a way that we can have quoting links. If you notice here over in the tools section, there it says quoting link. You can actually copy that and you can put it in your email, and that way, and that's the image that will actually pop up for this one. And they can click on it and they'll get a quote themselves. So it's very good for emails. Go ahead and copy that, put it on your signatures, and then they can do it themselves.
And an agent could embed that on their website as well?
Yes, absolutely. We can always private label this to where it doesn't say Messer Financial and has your own agency.
Great, great. To buy this tool, do we have to contract with you? Well, we would love to have you contract with us, but the tool is available for purchase through our website. Again, it's $65 a month. Let's see here. Do I have to buy this software to get paid commission? No, you do not.
Okay, so if here's another question. It says if you were in another state, what plans are going to show up on my software? Again, it's every plan that is available in that market is going to be on the cloud software.
Last year, I think we could limit some of those too with the request, correct?
Yes, we can. Absolutely, we can filter. Like I said, filter the carriers that are shown, so that if you want only what you are appointed with, we can do that for you.
For off exchange, are quotes only available from individual carriers? Yes, at this point, I think is the answer to that. Definitely is not quotable through here.
That is correct. Yes, off exchange has to go through the carrier's website directly, and as a matter of fact, so do the applications. So again, the off exchange just will not work on our cloud software.
All right. How do we request the client port Excel sheet? You can email any of us here at Messer. You can email producer support at Messer Financial. You can email Micah Matthews or Jay English, or you can reach out to us by phone. There's a number of different ways that we can get that sent to you. Maybe it's something we might even put out in a blast to people who've had this in the past. I think that might be a smart decision. We do have a final question here. Is the quote tool for ACA 65 and there's no charge for the other tools, correct?
That is correct, yes. The ACA software is the $65. The MedSup and any other quoting tool is absolutely free of charge, and anybody can use those regardless of their current status.
All right, that looks like the end of our questions. We really, oh, wait a minute. Is there commission for ancillary? That just came in.
Yes, absolutely. Every ancillary product that is on our cloud software is commissionable. So if there was a product that wasn't commissionable, it would not be on there.
As a matter of fact, sometimes you're going to get more out of doing the ancillary products than you will out of writing the medical insurance itself, especially in states like ours here in North Carolina where things are very limited.
Yeah, this is the year you definitely want to take advantage of the bundling opportunities. Being that the software now has those capabilities, it's really going to supplement any kind of lower commissions from the ACA and make it worthwhile to actually sell. Let's see, it looks like there might have been one more question. South Carolina only has Blue Cross Blue Shield of South Carolina, correct? Yes, that is correct this year.
Yep, that's right. North Carolina only has Blue Cross as well, our own state-specific, and what we're noticing is that tends to be a trend. We've got a lot of the major players are pulling back right now. Without getting too much into product-specific questions on this webinar, we're already 15 minutes over on that. But I wanted to thank you all for taking time out of your day and hopefully you've learned a lot about some of the tools that we have available to you. Again, if you have more questions or you want to talk in more detail, please reach out to us. We'd love to hear from you. Our office number is 704-568-9649. You can call in, you can ask for Micah or myself, Jay English, producer support, anyone in marketing. We'd love to talk to you about our software, about our products, and how we can help you make the most out of this opportunity during AEP and OEP.
Absolutely. Thank you, everyone.